Hello, everyone. I think we're ready to get started. Can't believe the day is finally here to reveal our name. I can't tell you how many people have been trying to work it out of me the last couple of months. This table here is very guilty of that. So, good morning. I'm Christine Wills. I'm the interim CEO of Valeo. First, let me thank everybody for joining us today as we celebrate this historic merger between Valeo Behavioral Health Care and Family Service and Guidance Center. Together, we have proudly served Northeast Kansas for nearly 180 years combined. And today is a celebration of the future of mental health care and substance use recovery, not only in our community, but in the state of Kansas. This merger creates a stronger and more unified approach to providing comprehensive care, which increases access and allows to serve more children, individuals, and families in Kansas. The merger would not have been possible without the support of our board members. Please stand to be recognized. I would like all the board members from Family Service and Valeo to stand. I'd also like to thank all the elected officials that have made time to be here this morning. Could you all stand? And I'd also like to thank our community partners and our dedicated staff who, if it hasn't been announced, we're live streaming this and our staff are back at our agencies doing watch parties watching us right now. So they hear the name at the same time as everybody else. So a shout out to all our staff. So, yeah. And finally, I want to send a thank you to the media for being here to help us get this important message out to the community. So, in closing, we want you to know that we are extremely excited and we're working hard to ensure that this merger will positively impact the most vulnerable among us. Thank you.
I'm Kathy Mosier, CEO of Family Service and Guidance Center. It is my privilege to welcome you on behalf of our boards, our staff, and the thousands of children and adults and families that we serve. You could be anywhere this morning, but you choose to be here, investing your time in building a healthier, stronger Shawnee County. For that, I'm deeply grateful. And today, I'm going to focus on what's happening right here locally, how we are modernizing mental health care in Shawnee County, and how the results are undeniable. Then we will share with you a historic moment before bringing in our guests to zoom out to the state perspective and the town hall. For decades, Topeka has been served by two remarkable community mental health centers. FSGC, specializing in children, and Valeo, specializing in adults. Both excellent, both essential, but families don't live in silos. A child's anxiety affects their parents, and a parent's recovery shapes their children. Yet too often, families have been forced to navigate two systems, or even more across our community systems, two intakes, and retell their story at the hardest moments of their lives. These barriers are being eliminated between our organizations. Also, both agencies became certified community behavioral health clinics. I know that's a mouthful, but please know this is now the gold standard of care nationwide, right here at home. But running two separate CCBHCs in the same area was costly, duplicative of services and staff, and stretched our workforce thin. By uniting, we create one front door, one system of care, one family story, no more barriers, and a more efficient workforce. We're already seeing benefits, better access, better quality, and better outcomes. Better access. Our wait times between our two organizations have already been reduced by 75%. If people come to us, we meet them where they are, in homes, schools, shelters. An example, over 500 at-risk students who otherwise weren't engaging in treatment were able to access services directly in their schools last year because we partner with our schools so they can focus on education and we can do what we do best. Better quality. Client satisfaction is at an all-time high across both of our agencies now. Clients have rated their satisfaction with both organizations 98.6%, so really rounds to 99%. That's going to be hard to beat next year. And of the kids in the schools that we serve, 94% of those students served improved their attendance at school. They don't have to leave to come to an appointment and then not make it back for the rest of the day. 86% improved their behavior based on the behavioral write-ups that were getting at school. 69% improved their grades within the school year. That gets us, and is a nice segue into better outcomes. We are just in the beginning of what we will achieve because we just started with our new model. That's what we can say that we've already accomplished is that psychiatric hospitalizations across both our organizations reduced by 95%. That's lives stabilized, suicides averted, families intact, and millions saved in taxpayer dollars. It's on January 1st we officially become one, coordinating care seamlessly across the lifespan. Let's get real about that. A child with anxiety seen within a day, not months. A teen battling both substance use and a mental health issue, supported by one integrated team who provides both treatments in a coordinated way at the same time. That's best practice in action. A person in crisis finding help 24 hours a day, 7 days a week, and not sitting in an ER waiting room for that service. A grandparent and grandchild walking through the same door, sharing one system of care. All of this is what mental health modernization looks like. It means safer neighborhoods, stronger schools, healthier workplaces, and a more resilient community. Cutting mental health funding has been tried before. We are just coming out of decades of underfunding, and it taught us that it causes delays in access. It causes more hospitalizations. The workforce shortage, when you can't provide a market wage, then you can't fill positions to address the need. The increased costs for courts, law enforcement, DCF, foster care, homelessness, and on and on. The cost is always higher on the back end. By investing up front saves lives and dollars. In fact, it's a 5-to-1 return on investment, $5 saved for every dollar spent on mental health and addiction recovery. And that's growing with the CCBHC model. We just have to stick with it. Shawnee County, this is our moment. With your support, we can prove that when government, community, and our providers stand together, we build something stronger than we ever could alone. Now let's make this merger official. Chris, will you join me? You don't get to retire just yet.
Retired.
Would you like to tell them what's next?
Yes, with this historic moment, we'd like to invite you all to officially witness the official signing of our merger agreement. So. Kathy can now keep these pins in her office, so.
Good morning, everyone. My name is Ashley Gilfillan, and I am here as the chair of the Valeo Governing Board. It is with great pleasure that I stand here with you this morning as we launch our new organization's name, logo, and tagline. Through the discovery process, we learned that the new brand should convey compassion and trust, expertise and professionalism, community connection, empowerment, inclusivity, hope, and that it should also work to destigmatize behavioral health care. That's super simple, right? So, keeping all of that in mind, we collaborated with MB Pineland and we sought feedback through a survey of leadership and staff. We also held focus groups, which included board members, community members and partners, individuals with lived experience, and the family members of those with lived experience, as well as the media. Many of these folks are here with us today, so if you helped us throughout this process in any way, please stand while we'd like to acknowledge you, your appreciation also with a warm round of applause. In closing, it is my honor to express deep and tremendous appreciation to all the board members, and particularly the leadership for the collaboration that has been put through by both Kathy and Chris in this organization. Thank you both for taking this proactive step forward for both organizations, and most importantly, for the individuals that we serve as a whole and as a community. And now it is my great honor that we release to you the next exciting part, our name reveal video.
When you struggle with your mental health, it can feel dark as night. But even on the darkest night, the stars are there. Valeo Behavioral Healthcare and Family Service and Guidance Center are uniting to serve our community as Astra Mental Health and Recovery. Together, we will provide better access to more people and the same compassionate, exceptional care for those already with us. Same locations, same staff. Healing within reach.
Seems like that's going to be tough to follow. For those that don't know me, I'm Mike Cross, and I've had the pleasure over the last several years to serve on the governing board of the Family Service and Guidance Center. And I think one of the first things we do after seeing the name reveal is take one more second to just recognize everybody that played a role from both organizations. So one more round of applause for all the effort that went into this. I think one of the things that both organizations are most proud of when it comes to this is that we pulled inspiration, not just from the community we serve, the people we serve, the teams that work to make the things we do happen, but from our state's great motto, ad astra per aspera, to the stars through difficulties. And I think for all of those who have any involvement in mental health and recovery, whether it's lived experience, through work, through your efforts, through family, friends, community, they understand where that motto comes from when you think about mental health in our community. So at Astra, mental health and recovery signifies the joint pursuit of providing more people the high quality behavioral health care they need and deserve in Shawnee County. Take one more second, just thank all of you for joining us to recognize this historic moment. A lot of you who've been involved in either Valeo or Family Service and Guidance Center, this has been kind of that thing on the horizon for decades, but then people say more than decades. So for a long, long time, I heard a few chuckles around the room because those of us who have been involved, this has been a thing we've talked about, we've seen, we've heard, and we've all thought too difficult, too hard to get there. Today's the reality. This thing got there, and we're going to make it happen. So do you want to make an applause for it? I agree. But we can't lose track of the fact that we're not there yet. The finish line isn't there. There's still people out there we have to continue to serve. There's still a community we have to continue to make healthier. So as we continue to bring our support together for Astra, let's think through what we can continue to do to put more life-saving work out there in our community. We're going to take a short little break here, and then following the break, we'll come back for the town hall. It's about 10:30 now, so actually let's take 15, shoot for 10:45, grab some coffee. There's refreshments in the back, and we'll meet everybody back here, 10:45, community forum time. Thank you all.